Hello and welcome everyone to our webinar on going back to school with epilepsy. I'm here today with my excellent colleagues, Dr. Maite Vega and Dr. Kevin Gurcharran. So today we'll be talking about some helpful tips on how to make going back to school with epilepsy a success. Next. So we'll take you on a journey through some of these topics about how to prepare your checklist, partnership between parents and school, administration, safety at school, how to respond during a seizure, recording seizures, when to call 911, seizure first aid, and seizure action plan. Next. Back to school. Are you ready? Summer has come and gone, and it's almost time to welcome the new school year. So living with epilepsy while going to school has its own challenges. And whether it's first day of kindergarten or your child is going back to college, we're going to help you with some of the tips which can make this transition a success. Next. So why do we prepare to go back to school with epilepsy? As the caregiver for your child, you must have seen how frightening it is to witness your child's seizure. And you have learned how to take care of your child during a seizure. Now, you've learned how to recognize a seizure, how to prepare for an emergency, how to respond to an emergency. And having to learn all of this and then handling all that responsibility to school and entrusting all of that care, all the steps that you have learned onto somebody else is another level of care that you want to transition. That's why the antidote for that anxiety of entrusting the care for your child is to prepare and educate. Next. The first and the foremost, I would like everyone to know that there is a law by which the schools are obligated to provide accommodations for students with disabilities. Federal law section 504 of the Rehabilitation Act of 1973 protects students with disabilities to ensure inclusion in any program with federal funding or assistance, such as public and many private schools. Now, a child with seizure disorder may not have a visible disability, but because it is a chronic condition, it is part of the law. It is applicable by the law. Children with seizure disorders have full right for school participation. So let's say if you think that your child needs some support in school, they should have something called as a 504 plan. A 504 plan, it's a written management plan which explains how the school will accommodate your child's medical needs. Whereas if your child is experiencing learning disabilities or behavior issues, which can affect their academic aptitude, then the students should have an IEP, which is an individual education plan, which can help them participate and succeed in the general education curriculum. Next. This is just a sample 504 form, and I apologize if the font is small, but I just wanted to highlight just a few things on this form. I just circled things like paraprofessional support, if your child needs help with transportation, things like elevator pass. This is how to go about it. You basically need to ask the school to provide you a 504 form, talk to your provider, and then speak to the school how we can add these accommodations to your child's day-to-day school life. Next. Communication is the key. You are your child's best advocate. So communicate openly with the school staff. Meet with everybody who's involved in your child's day, right from the bus driver to the teacher. As you know, seizure can happen anytime, anywhere. So you need to include everybody, including the PE teacher, coach, bus driver, art teacher, lunchroom monitor, the substitute teacher, everybody. They all need to understand your child's needs and their role in supporting them. Next. So when you talk to these caregivers, what do you tell them? you've got to convey these three important things: how to prevent an emergency, how to recognize an emergency, and how to respond to an emergency. Now, oftentimes when the training is provided to the teachers and caregivers, the focus or the emphasis is mostly on how to respond to an emergency. Things like preventing and recognizing is often overlooked. Next. So how do we prevent an emergency? Prevention begins at home. So establish routines, adjust the sleep, meal, and the medication schedules for a smooth school transition before the school starts. If before changing any of the medication schedules, it's always a good idea to consult with your healthcare provider, talk to your child, discuss any concerns your child may have about seizures at school. Some kids are very open about their seizures, while others may feel very embarrassed. Reassure them that they're not alone, that there are others who may be facing similar challenges. And you can also work with the teacher to educate. Can you back up, please? You can also work with the teacher to educate the class about epilepsy in an age-appropriate and supportive way. Schedule parent meetings. At the start of the year, you meet with the teacher, the nurse, bus driver, and support staff and talk about a detailed seizure action plan with the school, as well as encourage the staff to become seizure first aid certified. Next slide. Schedule appointments. So make time to meet with a behavior counselor or a therapist if your child requires regular sessions. Connecting early will help address any other concerns. Let's say your child has an IEP. Make sure you ensure that all the resources which are being provided are in place. If you think the child needs any accommodations, make sure that the child has a 504 form filled out. Talk to the teachers. So you want to talk to the teachers about how the child's epilepsy may be affecting child's learning and behavior, how the medication side effects could be helping or worsening, and about any difficulties with attention and memory, which could be stemming from the child's epilepsy or some of the medications. Next slide. So some of the additional tips that I wanted to share is that always make sure that your 504 or seizure action plan has detailed information, and give consent to school to contact your healthcare provider. The school nurse is going to be your best friend. So always establish a great relationship with the school nurse. Manage the medications, make sure that the expiration dates are up to date, make sure if there's any change with medications, you update the seizure action plan promptly. And I cannot emphasize enough the importance of sleep. Lack of sleep can trigger seizures, so make sure that kids have their bedtime and routines established. If there's a special event, let's say there are field trips or extracurricular activities, consider volunteering or chaperoning so you can be present during any potential challenging situations. Next. Next is how to recognize an emergency. So you can have your child wear some of these medical identification bracelets, and some of these are available online, or wear something that identifies your epilepsy, that identifies their epilepsy in case the child has a seizure around unfamiliar people. Let's say you get a call from the school nurse or the teacher. That's when you got to describe your child's seizure type, the triggers for the seizure, and the warning signs. Define what qualifies for an emergency. When should the teacher or the caregiver call 911 and seek additional medical help? Consider educating your child's classmates about epilepsy. This will help your child feel more accepted, prevent bullying behaviors, and also equip other students to recognize warning signs and report. Next slide. Last but not the least, respond to an emergency. You've got to make sure that everybody who's part of your child's care team is seizure first aid certified. Keep the seizure action plan, contact information, and medication details up to date. Provide backup contacts for any emergencies. Give the school nurse the rescue medications with your doctor's instructions. And we're going to hear a lot of good information about seizure action plan and rescue medications by our excellent Dr. Maite soon, very shortly. Next slide. I just wanted to highlight the importance of educating your child's classmates. It is frightening for a child to witness a seizure. So educate your child's classmates about seizures, which can actually reduce stigma, fear, and promote more acceptance. Have an open conversation with your child. Explore when, where, and how they want to tell others, and practice how to share this information. You can work with the teachers and your child together to create an inclusive environment. You could even be a special guest or presenter for the day and help kids learn more about epilepsy. Some websites like Epilepsy Foundation even offers some helpful resources, and you can look into that as well. Remember, education is the key to reducing stigma. Next slide. Epilepsy and college education. Some of the kids who are considering going to college this year, they may have a few questions in their questions which are going through their mind, and I just want to address a few of these. So would you feel more comfortable at a small school or a large school? Now, a small school may be able to give you more attention, but a large school may have a bigger choice with your subjects and may be able to, give you more extracurricular activities. Do you feel comfortable managing your seizures away from your family and friends or at home? So in other words, you want to go to an away college or somewhere closer to home. That depends on how much resources do you need to manage your epilepsy, how well managed your epilepsy is. The other thing is that you want to know whether there is any commute to the college. Some kids with epilepsy are able to drive, so that for them it's fine. But for others who are not able to drive, is there going to be public transportation available? Those are important questions to consider. What services or accommodations does the college have for students with disabilities? By law, colleges are supposed to provide accommodations and be inclusive to every child who has epilepsy, and things like priority registration, course substitutions, note takers, recording devices, or sign language interpreters, and extended time for test taking are all available, but it's your responsibility to be able to tell the school or the college that you have that you are in need of these resources. So if you've got to contact the disability office as soon as you choose the college and let them know that these are the services you'll be in need of. Does the college have a health center? And will you have a roommate? So if you do have a roommate, it's a good idea to let them know about your diagnosis, because they may be able to get a seizure first aid certified, but eventually it's your decision how and when and to who you want to share about your diagnosis, how much you want to share about your diagnosis, because this is it has to come from you. It has to be your idea. Next slide. And remember, we don't have to do all of it alone. We are never meant to. With this, I would like to introduce the next speaker for today, which is Dr. Kevin Gurcharran. Thank you.
Thank you, Dr. Verma. Good afternoon to everyone. Thanks for taking the time to listen to us and talk about these important topics. I'm Dr. Kevin Gurcharran, and I'm going to talk a bit about safety at school. Other than being at home, school is probably the place where kids will spend the most time. It becomes important to be able to help create an environment that is safe for them, but also an environment where they feel safe. Going over some of these things can hopefully foster some of that. Next slide, please. From a physical standpoint, it's not too hard to imagine the physical consequences the seizure may have. So, whether that's falling down, getting hurt, trouble breathing. However, sometimes the problems we can't see can be just as important. And the psychiatric effects that happen because of a seizure or having epilepsy are things that become extremely important in the lives of our, the children and our patients. And so they can have things like the fear of just when will I have another seizure, or when's it going to happen? Will it happen to me again? The embarrassment of having a seizure in front of others, especially their friends, developing anxiety or depression because they feel like they're losing their independence. And so it's important to always reassure them or reaffirm that seizures and epilepsy are a part of them, but it's not the thing that defines them. And so by having some of these different safety things set up and learning and having precautions, it can really help to foster some of that normalcy and really help to alleviate not just the physical concerns, but also the psychological concerns that the child may have as well. Next slide, please. And so what are some things that we can do to reduce the risk of seizure? And so as you go forward in the journey, sometimes triggers can be identified. So things like stress or flashing lights, even hormonal changes. Some things are less avoidable than others, but certainly if those things can be cataloged, there are ways that we can try to avoid them. Even if someone is on a medicine, there are still things that just make it easier for a seizure to happen. And so anytime someone has a fever, lack of sleep or poor sleep habits, so pulling an all-nighter, for example, if you're on medication, missing doses or being inconsistent with your medication, not eating well and having low blood sugar, being dehydrated. So your body likes consistency, and trying to maintain these things as best possible are ways that we can or they can help themselves to try to prevent seizures from happening. There are lots of different medications and drugs that can make it easier for a seizure to happen. So, illicit drugs, like including things like marijuana, alcohol, are things that can make a seizure happen, even if someone doesn't have a risk for seizure or epilepsy. Different types of medications can interact with parts of your body and then cause the way that the medication gets broken down. So you may then have too much medicine in your system or too little medicine in your system. So being mindful of any other medications you're taking become important. And that also goes for over-the-counter medicines. So even things like Benadryl or certain cold medicines can have effects on your body and make it easier for seizures to happen. So being mindful of those things can go a long way in trying to help prevent bad things from happening. In terms of commuting to school, so certainly having a school bus is always nice in the sense that it gives you that some sense of security that we know they're getting from home to school in a more sort of watched fashion. But in terms of the need for extra help on the bus, so oftentimes we will get asked about a paraprofessional or a nurse that needs to be on there. It's not always necessary if the seizures are well controlled, so it really depends on the patient. But certainly if they have developmental issues or behavioral concerns, those are kids that will want to watch more carefully, or if they have very frequent seizures. Um, if they are not traveling by bus and are someone who's very independent and prefers to travel alone, or that's just what's needed, having a travel buddy or a friend who may be going to school at the same time as them is always great and can be very helpful. Making use of all the technology we have now. So a lot of the different medical alert bracelets, a watch, the different types of watches, your cell phone can be ways to just say, hey, I got to school or everything's okay. And then at least we know where they're at and can be reassured that they're on the right path. Next slide, please. And in terms of actually being at school and trying to find ways to feel safe. So a lot of the times being your own advocate is really helpful. So if you're not feeling well, making it known to the teacher, the nurse, and so being able to then go and get help becomes important. Keeping track of all the different things we spoke about. So the triggers, keeping your school updated, having that seizure action plan up to date, the rescue medicine there, making sure it's not expired. These things do have a shelf life. And so while it may not hurt to take the medicine, the effectiveness does get reduced after the expiration date. So all things to keep in mind. As Dr. Verma mentioned, finding ways to educate the people around you are a great way to help you feel safe. And the local epilepsy foundations oftentimes have really wonderful programs that can help teach people as to how to react and what to do. And then also similarly, as Dr. Verma was saying, having those 504 accommodations. So even outside of just the seizure part of it, seizures can have consequences in other parts of someone's learning, their development, their memory. And so having those extra accommodations can go a long way in helping someone to feel comfortable in being in the school setting. So whether that's extra time on tests or tutoring, those are all services that are available and can be quite helpful. Next slide, please. In terms of the use of paraprofessionals, so for older kids, we may get a lot of pushback because having someone follow you the whole time is generally not something they would like. And so paraprofessionals certainly can play a really pivotal role in helping keep the kids safe. And so where we tend to think of the paraprofessional being extremely helpful is if you have a child who may not be able to advocate for themselves very well and have developmental issues or very frequent seizures where you want to have a little bit more of a watchful eye on them. If they have seizures where they can really hurt themselves. So some kids have seizures where they can fall down and have a sudden loss of muscle tone in their body. And then as a result, they can really get hurt. And so when we have different situations like that, it really then becomes helpful to have an extra set of eyes on the child and really be able to help them. Next slide. In terms of sports and physical activities, so exercise is great. It can really be beneficial. And exercise itself generally does not cause the seizure. Sometimes if you're exercising in certain conditions, like if it's really hot, or if you forget to drink water, like those are things that can precipitate a seizure if you're exercising. But the exercise itself generally is safe and it's great for your body. As with anything, if you're not feeling well, that's your cue to take a break and step away. Like yes, there are precautions that we want to take, but you know yourself the best, and so if you're not feeling well, that's the cue to stop. Water is something that we always want to be very careful around. And so really should not be doing any unsupervised swimming. If you are going in a pool, having a buddy with you is always great. Other things that you want to be more mindful to avoid in general are things where you could fall from a certain height. So usually more than 3 feet, if you can't protect yourself, you can seriously get hurt if you fall down. And so certain activities where that may happen are things to avoid. And that even comes into play in things that may not be so obvious. So climbing a ladder to go put up decorations or things like that, or doing painting. So being on a ladder or some other surface like that where you may be high up, not necessarily a sport, but also just another thing that you just have to be mindful of and sort of put into context what you're doing. Next slide. And then in terms of, being on parts of teams and more competitive sports, if there's ever any question, that's what we're here for. And so having an open dialogue with your doctor can go a long way to helping reassure things. In general, you always want to wear the same standard safety equipment, so that holds true for anything. Most non-contact sports are pretty safe, so things like swimming, tennis, are generally okay, and there's really not much reason not to do it. When it gets to more of medium risk things where there may be contact involved, both in team sports or individual sports, then that's where putting together what's going on with the person on an individual level becomes important. So if there's someone who's having a lot of seizures, probably not a great idea to be in competitive football, for example. But if seizures are well controlled, then a lot of these other sort of medium risk things are generally okay. Things that are more high risk that probably should avoid just in general unless seizures are resolved or the competitive skateboarding, motorsports, rock climbing, scuba. So those are things that by and large we will generally say we should avoid as much as possible. But the idea here is to try to have kids feel like they can participate and feel empowered that they can do a lot of the things that their peers can do. So yes, we need to be cautious, but there's still plenty that can be done and it doesn't have to limit the things that we do. We just have to be careful. Next. So when it comes to driving, so in New York State, you can drive even if you have a diagnosis of epilepsy, even if you're on medication. The main thing is that you just can't have a seizure for a year is what the general law is. And so, we even if someone's on medicine, it's oftentimes a good incentive for our teenage patients to say, hey, you need to be on your medicine because if you want to drive, it's okay, but you need to be taking your medication. different states have different rules. So, you know, if you are in a different state or are moving to a different state, you may have to check the regulations because the timing may vary 6 months as opposed to a year, or they may have other rules in place. But at least in New York, it is very much a possibility and allowed. Next. And so that's all that I have for now, but I'll turn it over to Dr. Maite Vega to talk about seizure first aid.
Hi. Hi, good afternoon, everyone. Thank you for being here to listen to this educational program. So I'm going to talk about responding to seizures, seizure rescue medications, kind of go over the legal rights again, and first aid and creating a seizure plan or seizure action plan. Next. Oh, that's the one, sorry. So first, it's very important that if somebody has a seizure, is to remain calm and focused during the child's seizure and ensure the life of the child is safe. It's very important to know the child's specific seizure types and triggers. And for that, to know all these about your kids, that's when every kid has to have an individualized, a specific seizure action plan, or it's called here in New York City, 504 seizure medication administration form. Okay. Next. So before we go deep into the seizure action plan for the school, there are a few steps that we have to follow at home. So remember, anybody can initiate a seizure action plan or can write a seizure action plan. Could be the pediatrician, could be the pediatric neurologist, could be a nurse practitioner. But it happens that the doctor may know your child over many years, and he knows your child's seizure types, medications, duration of the seizures. But let's say that you move medical care from one center to the other, or you move from one state to the other. So that doctor is not going to be very familiar with your kid's seizure. So at that point, it's very important that at home, you follow these kind of steps. Number one, seizure medication. It's very important. There is a consistent administration of the anti-seizure medication at home. Also, informing to the school the medication schedule that your patient takes, and also the side effects that this medication may be causing to your child or may happen. It's very important to know the type of seizure that your child is experiencing, and that could be by verbal description of the seizures, or you can take a video with your phone and show this to your healthcare provider. Also, monitor for side effects. We talk about that. Next, recording of the seizures. It is critical to document the seizures the child is having, including details like the time, duration of the seizures, and type of seizures. So for this, there are several tools like seizure diaries and mobile apps that can assist you on tracking the seizures. Like there is an example in the slide of the seizure diary, something that you can upload for free through the Epilepsy Foundation. And Epsi is one of the apps that among so many that you can find in the Apple Store. This is very important to share this information with both the healthcare team and also the school. Next. The other part to tailor your seizure action plan is when to call 911. So now knowing the type of seizures for your child, the duration of the seizure is very important. for the healthcare provider to tailor your seizure action plan. Not all the seizures, they had the same, not all the kids, they had the same type of seizures and seizure durations. Usually it's necessary to call 911 when a seizure lasts longer than 5 minutes or when multiple seizures occur without recovering in between. It is important to have in the seizure action plan the information about your child's type of seizure diagnosis. Also, if the patient has a history of frequent prolonged seizures or status epilepticus, how the child responds after the seizure, if the patient had epilepsy surgery in the past, if the patient has one of the devices implanted to treat the seizures like a Vega nerve stimulator, responsive neurostimulation devices, or deep brain stimulation. This information is very important for the emergency medical services and emergency responders. It's also very important to stay with the child until help arrives, and that will be at home and at school. Next. Type of rescue medication. So first of all, what is a rescue medication? Rescue medications are FDA-approved medications to use for emergencies like acute repetitive seizures or prolonged seizures. Why do we need rescue medications? Does everybody need a rescue medication? So, well, seizures, they can be short in most of the times, but sometimes seizures come in clusters, and those clusters, they can sometimes progress into prolonged seizures or status epilepticus. So these repetitive seizures, prolonged seizures, and or status epilepticus has a high morbidity, high risk of hospitalizations, complications due to prolonged seizures, in some cases can cause mortality. That is why it's so important to treat and stop the seizures promptly. So now, not all the patients are at risk of having clusters or prolonged seizures. That is what is so important, to give the accurate information to your healthcare provider about seizure types and duration, and that has to reflect in the seizure action plan. So what are these medications? What the medications that are FDA approved to use for rescue? So there are already 3 medications FDA approved for the use of rescue at school or at home. One is diazepam. It's called Diastat. It's a rectal gel. Diazepam, also the same medication, but in a nasal spray form. It's called Valtoco. That's the brand name. And another nasal spray is called Midazolam, which is in the brand name is Nasolam. These medications were FDA approved. They are safe. They work in a small volume. They should work for almost all the seizure types. They are easy to administer. They have very low side effects, and there's no need for a special monitoring after the medication is given. So the question will be, what medications the healthcare provider will choose for the patient? So nowadays, the 3 alternatives, the first one is diazepam rectal gel, which is FDA approved to be used for children that are 2 years and older. The preparation comes in a gel form, and it comes inside in a plastic syringe. It's the oldest FDA approved medication since 1997. The dose is already calculated in the syringe. When it's used, it protects the child from having another seizure for around 4 to 24 hours. So it has a long duration. There are societal implications about using a rectal form. So we tend to use that in smaller kids. Sometimes it's also difficult to administer in kids that they are in wheelchairs or they have a big size. So For that, there are alternatives, and the alternative will be the same diazepam, but in nasal spray, which is called Valtoco. This one is approved only for the use on kids that are 6 years and older. They have the same advantage as the Diastat because it's the same compound, but it's easier to administer by school personnel like teachers or nurse. And it still can be used even if the patient has a nasal congestion, so that's no problem. Midazolam is another FDA approved, but that will be for kids that are all over 12 years. Next, how to use these medications, how to administer the Diastat. Well, there is instructions that you see there. The Diastat, you have to place the patient on the side, take the medication out of the box, take the cap off. There is a lubricant that you have to add, put it on the rectal area. It's like a jelly. And then place the patient on the side on a fetal position. On a fetal position with the bending the legs forward. Then gently you can insert the syringe into the rectum, push the plunge, then slowly take out the syringe. Then after that, you can press the buttocks. You can count until like 3. And the reason of doing that is to prevent leakage of the medication. We have the other alternatives. So how to use the nasal spray. So the nasal spray, both of them, the Valtoco and the Nisalan, they can be used the same. The administration is the same. You remove the sprayer out of the blister pack. Then you hold the device with your first and middle finger around the nozzle and then the thumb under the plunger. Then you put the nozzle inside the nostril and then press the plunger. You count maybe until 3 before you remove it. So those medications, the nasal ones, they come in different dosifications, and the doses are going to be given according to the weight and the height and the age of the child. And that's something that your healthcare provider is going to calculate when, in the visit when he sees the child. For example, diazepam spray, which is called Valtoco, come in different doses. 5 and 10 milligrams dose is going to be only 1 spray that you're going to use in 1 nostril. And doses that are bigger, like 15 and 20 milligrams, it comes in 2 sprayers. So they are divided in 2 doses. So 1 dose is used in 1 nostril, and when you finish with 1 nostril, you take the other sprayer and you use in the other nostril. With the midazolam or nasalan, it comes only 1 single dose of 5 milligrams and it's only 1 spray. Next. So there is also an off-label use for treating acute repetitive seizures like the vagal nerve stimulator. So not every child has a vagal nerve stimulator. Only kids that they have a history of drug-resistant epilepsy, they have this device, which is a device implanted by a neurosurgeon under the skin. And it works to help to control seizures by sending electrical impulses to the vagal nerve, which is a nerve that is on the side of the neck, and that sends all these impulses to the brain. So when to use the vagal nerve stimulator, it should be used. So if that patient has the vagal nerve stimulator, the company is going to give 2 or more magnets, and 1 magnet, it has to be given to the nurse. And so she is going to swipe the magnet as soon as the seizure starts or the onset of the seizure, or when the seizure is prolonged. So in the seizure action plan, it should be detailed instructions on how to use the VNS, including how to swipe the magnet over the device, and monitor the child response, and repeat the swiping of the magnet as necessary according to how it's explained on the child seizure action plan. Next. So legal protections in school laws, as Dr. Verma spoke explained before, there are key laws that protect children with epilepsy in school settings, such as the Individuals with Disabilities Education Act, or IDEA, Section 504, and the Americans with Disability Act, ADA. So a patient should have an individualized education plan, IEP, and a 504 plan. Now, a seizure action plan or medication administration form is different from the 504 accommodation plans, as Dr. Verma explained. The 504 accommodation plans are individualized to the kid's needs, and they are more regarding if the patient needs a paraprofessional, he needs elevator pass, if the patient needs a nurse, he needs devices at school, like oxygen tanks, things like that. And then the medication administration form or seizure action plan is different. It's what we explain about what to do in case of the patient has a seizure, when to call 911, what kind of seizures the patient have, when to use medication rescue, and etc. So under the law, all children have rights regarding medication administration, and the school is responsible for doing, for making sure that these medications are administered and the patient have a safe and secure place. Next. In the seizure action plan, one of the areas that we have to fill up is what's called seizure first aid, what to do in case of the patient has a seizure. Now, there are different types of seizures. There are generalized tonic-clonic seizures, and there are seizures that are a little less, the manifestation is more subtle. So in the first aid, so the first thing that we have to explain is that the basic steps to take when the patient has a seizure. For example, like protecting the child from falling or from having an injury. In case of a generalized tonic-clonic seizure and loss of consciousness, place the patient on the side, staying with the patient, observing the seizure and also timing the seizure. One person at school stays with the patient, observing and timing the seizure, while the nurse brings the medication from the medication room and gets it ready for administration in case the seizure is prolonged. What not to do in case of a seizure: we are not supposed to restrain the child or putting anything in their mouth. And how to care for the child after the seizure: stay with the patient, help the patient to recover, and provide reassurance when the patient is regain consciousness. You know, a lot of kids, they become agitated or confused. So a little reassurance, it will be very helpful. Next, the forms to fill out, or the forms that are necessary, it will start with the medication administration form, which is from the school district, and these forms change every year. Next. maybe back. So the school district has a specific form, and the seizure action plan, I will show you the pictures how they look like. It's kind of the same. We're explaining the same, but two different forms. If your child is in the New York City school district, they usually have a specific form, which is called medication administration form. This one changes every year, and it needs to be, it changes with every academic year. That means that it needs to be filled by the healthcare provider, and it needs to be updated every year because the seizures can change, the weight of the patient changes, and the medication changes. So it needs to be updated with the doses that to reflect that current weight and seizure status in the patient. And also it needs to be updated if the patient has something new, has recently had an epilepsy surgery, or it has a recent device like the vagal nerve stimulator. Also, when you have the forms, please, it's very good. I always recommend the parents keep a copy to yourself. And the reason is because sometimes at the beginning of the year, it gets kind of crazy in schools and some forms can get lost. And it's very good that parents, when they get the form filled up and signed by the healthcare provider, make a copy for yourself and then bring a copy for the nurse, teacher, and administrators in the school. Next. In the seizure action plan, so make sure also that is well spelled and the emergency contacts also, and hospital and the doctor's name of the patient's treating physician and the hospital when the patient goes. If the patient goes to a different emergency room from where the patient usually goes, at least they have the contact numbers to call the patient's healthcare provider. Make sure that the seizure action plan is well understood and followed by the school nurses, teachers, and administrator. Next. This is an example of how the seizure action plan looks like. And this is used for any school, private school, charter schools, college also. Next. This seizure action plan, you can easily download it from the Epilepsy Foundation, the Seizure Action Plan Coalition, and the Epilepsy Alliance of America. There are put the links. They can be uploaded easy. And also now that a lot of the patients have my chart, you can download it into the my chart and send it to your healthcare provider to be filled up, which is very easy nowadays. Next. This is an example of the school-specific seizure action plan, which it depends on the school district where your kid goes. This is the link of how to find this form from the Department of Education of New York. And this form comes translated in different languages, as you can see. Sorry. Next. These are the national and local epilepsy organizations that offer support, resources, and educational materials like online courses, videos about seizures, videos about how to use medication rescue administration, training for school nurses. They also have online resources and forums where families can connect with other families that are facing similar challenges. And I encourage families to seek out community support groups and to use available resources to stay informed and connected. Thank you for attending this webinar, and I invite all the participants to ask questions and also share your experiences.
Hi, Dr. Verma. Hi, Dr. Vega, Dr. Gurcharran. Thank you for this great session. Hello, everyone. I'm Ankita. I'm the outreach coordinator for the Epilepsy Center. We have received a few questions from the audience that we would like to ask you panelists, and you guys can take it from there. So one of the questions is, can you share some best practices for how I can effectively communicate my child's epilepsy needs to the school staff and the community?
So I can take that. So I think the most important thing to do is in the beginning of the year to schedule meetings with the school staff and to let them know that their child has epilepsy, if there is any need for any letters from the providers to give them documentation. And then during that meetings to give them the seizure, the correct forms, the 504 form, the seizure action plan, and also to find out if there is any other accommodations that the child is eligible for, and discuss the idea about individual the IEP. You know, if the child doesn't already have an IEP, individual education plan. So, you know, meeting with the staff is the key, and then discussing all these issues early on in the school year is important.
Thank you, Dr. Verma. There's a question about rescue medications. A parent is asking, can the rescue medications interact with other medications that a child with epilepsy takes?
Yeah, take that. That's a very good question. It shouldn't, but so these medications are benzodiazepines, and benzodiazepines are usually it's a sedative type of medication. Okay, so after the medication is administered, the patient is going to be a little drowsy. The drowsiness, it shouldn't last for too long, especially for the nasal medications. The patient should be ready and awake and maybe back to baseline within an hour. Now, if the patient is taking another benzodiazepine as an anti-seizure medication on a daily basis, one sedative medication can potentiate the other, and he may be a little, maybe more drowsy, but not to the point that it's going to be an interaction or a very bad side effect. One of the things is that by law in New York State, that's the law in New York, that after the medication rescuing is being administered at school, even if the patient wakes up and is jumping around or the patient is drowsy, the school has to call 911. That's the law. So this patient, you always will be seen right away by the emergency medical services, and most likely it's going to be taken to the emergency room, at least to make sure that the patient is okay. But with the rescue medications, we will prevent a lot of issues like prolonged seizures, hospitalizations, or patient ending in an ICU because the seizure doesn't stop.
Thank you, Dr. La Vega. There's a question. A parent is asking, their child is 18 years old now, and they're worried about their transition of care. Any tips you would like to share with this parent?
Sure, I can talk about it. You know, so transition of care is something that is a bit of a hot button topic when it comes to transitioning from pediatrics to adult, and that's not just with seizures, that's with a lot of medical conditions because kids kind of quote unquote age out of pediatrics at some point. And so there are a couple of important things to think about as your child is getting older, especially depending on how impacted they are. So things that sometimes people don't think about as they continue to get older is guardianship. So sometimes some kids may not have the full capacity to take care of themselves. And so being able to think a bit far ahead, because once they turn 18, there are a lot of different laws that change. And so legally, in order to make decisions for them, there is a court process that has to happen. And it usually involves filling out a lot of paperwork and getting documents filled out by your physician. So one of the things to think about is, do they need to be more directly supervised, and do you need to be their legal decision maker and their guardian, which is one thing. The other thing is that as someone gets closer to the age where a physician may transition from pediatrics to adult because they don't see a certain age anymore, is very early on, even when they're 16, 17, just kind of mentioning the idea of how do we transition to another provider. And so some of that is identifying qualified people who can take care of what the child has. So whether it's epilepsy or another specialty, even within neurology, neuromuscular conditions, for example, finding someone who is going to be well suited, and then starting the process of creating summary documents where it's really helpful to have a handoff from the doctor who's been seeing and knowing the child presumably for years or months to someone who will be taking them over brand new. And if that person has a long history, creating a summary document where they talk about the highlights of things that were done so that workup does not get redone, or invasive tests don't get done again. So being able to sort of create that and have that summary document becomes really important. And it can be a difficult transition, because in peds we love to hold on to our patients, and we really enjoy seeing them and the bonds we create with the family. And so it can be hard because it can be a very dramatic or different shift when you go from the pediatric world to the adult world. And so I think the more that you sort of have that conversation as someone is approaching 16, 17, 18, it sort of gives more time to then figure out, okay, am I heading in the right direction with whoever's going to take over my care? Do they have all the information, or will they have all the information they need so that my child is properly taken care of and can continue seamlessly on with their treatments?
Can I add something? One of the good things about New York State, the pediatric goes up to 21 years. So that's, 3 more years with pediatrics, but pediatrics, it's 21 in the state of New York. Some other states varies.
I
Thank
would
you.
like to add just one more thing. So, regarding transition of care, I think what I like to do in my practice is, if somebody's like approaching 16, 17, I like to give them the independence to start taking their medications themselves and not having to depend on the parents reminding them all the time. Because this is the stage you tell them, look, you're going to be an adult soon and you need to start taking your medications on your own. Because up until that time, when they're in the school before college, it's mostly the parents that they're reminding them to take medications. And once they're in college, it can't be like this, that they remember to take medications. That's a big one, I feel like, in my opinion, that giving them the control that this is your body, it's your diagnosis, and you have to be the one to take care of this condition yourself. Thank you.
Thank you, everyone. There's a question from a parent. They are saying their child has non-epileptic seizures. Are there any treatment recommendations for these type of seizures?
Yes, I can take. So if the patient has a full diagnosis with non-epileptic events or non-epileptic seizures, done with EEGs, video EEGs, that's how to confirm that. It gets out of neurology, and that will go more into the, it needs another support like psychology and psychiatry.
I think the other thing, sorry, please go ahead.
Yes.
And sort of similar, I think the other thing is that, even though it may be not necessarily an epilepsy-related seizure, sometimes still being able to have the reassurance of seeing the neurologist every now and then to just talk about your symptoms becomes very important. And so while they may not necessarily need an anti-seizure medicine to help, being able to have someone that they can talk to and say, I've been doing this, do we need to recheck anything, is a really important piece. And it's also important to not also, if they do get a diagnosis of non-epileptic seizures, to then think that they're faking. Oftentimes they're not faking. It's usually a subconscious thing where it happens due to some external event or internal trauma, anxiety, that it's the body's way of manifesting things. And so we never want to blame them or tell them to, like, oh, you have to stop. That's usually counterproductive to helping them. But setting them up with good psychiatry team, and then also again continue on with neurology, because there will be questions that come up. Even if things are proven negative, it's helpful to prove that negative, because it does help them to kind of come to grasp with that. So even though it does sort of shift more over to the psychiatry world, we still oftentimes do see them every now and then, and just add that extra level of reassurance.
Thank you, Dr. Gurcharran. I think these are all the questions we had from our audience, and thank you so much, Dr. Gurcharran, Dr. Vega, and Dr. Verma, for this super informative session. I'm glad people were able to get answers that they needed for their kids with epilepsy. Thank you.